Hello, welcome to the Mobile Neuroclinics presentation. My name is Benjamin Mkombia, and I will be introducing the topic of mobile neuroclinics. In this presentation, we will look at how mobile health clinics have been used to deliver healthcare to underserved communities around the world and in Uganda. In Uganda, there are drastic inequities of neurocare over different regions of the country. Thus, our team aims to improve and provide equitable neurocare delivery across the country. Our team includes doctors at Mulago Hospital and researchers at Duke University. Benjamin Mukumbia, myself, I am the lead student investigator. Yesel Triol Odones is a research assistant from Duke University. Kiying San, a research assistant from Duke University. Anthony Fuller is the principal investigator from Duke University. Michael Hagland is the co-principal investigator from Duke University. Oscar Obiga is a co-principal investigator from Mulago Hospital. Joe Kiriabire, a co-principal investigator from Mulago Hospital. Let's understand neurocare first. Neurocare is a type of specialized care for people with neurological disorders. Neurocare begins during pregnancy and continues throughout our lives. It could start with the food we eat. It can also be complex to the point of getting surgery and rehabilitation. It also includes preventative and curative care. Preventative care involves all efforts to prevent a person from being affected by a preventable neurodisease. Curative care involves provision of care to treat neurodiseases with the aim of curing them. In this bar graph, we see 22.6 million patients suffer from neurological diseases and require the expertise of a neurosurgeon worldwide. Of these, 13 million require surgery. Worldwide, 5 million people die every year for not receiving the necessary neurocare for treatable neurosurgical conditions. 90% of the patients occur in low and middle income countries. What does this mean in the larger arena of neurocare? This information reflects the high demand for neurological care around the world. However, it is not reflective of the real burden of neurocare. This map compares regions around the world for people seeking to consult a neurosurgeon. Compared to the regions in green and yellow, such as North and South America, Europe and Australia, the map highlights that approximately 90% of people living in the African region cannot afford to seek medical advice from a neurosurgeon. Uganda is located in the red zone, indicating that 10,000 or more people are unable to consult a neurosurgeon every year. This next map compares regions around the world for people requiring surgery for treatable neurosurgical conditions. More than 10,000 people in the African region are unable to receive the operations and surgeries they need. This implies that these individuals may contribute to the estimated 5 million people who die each year. Uganda is still located in the red zone, where approximately 90% of the global deficit still exists. The bar graphs below show Uganda's neurocapacity in 2020. Uganda had 12 neurosurgeons for its estimated 45.9 million people. Neurosurgeons primarily work in tertiary hospitals, which are located far from rural and remote communities. 78% of the population, however, lives in rural and remote communities. This implies that the available neurocare is readily available to the 10.1 million people in the urban communities, leaving out the 35.8 million people in rural and remote communities of Uganda. In Uganda, neurocare faces a variety of challenges, all of which contribute to poor patient outcomes. This map highlights how the distance prevents people from rural and remote communities from receiving the neurocare they need. Though the white areas of the map show no data, the majority of the population have to travel at least 4 kilometers and, at times, greater than 16 kilometers to reach the closest healthcare facility. The map clearly emphasizes that the majority of the population live in areas where healthcare facilities are far from reach. Moreover, this distance disproportionately affects Uganda's rural and remote populations in need of neurocare. Due to the long distances people from rural and remote communities must travel to reach a healthcare facility, time is another factor that affects neurocare delivery. The areas where we have data show that getting to the nearest healthcare facility takes more than an hour, and in red regions, it takes more than 4 hours to reach a healthcare facility. In many instances where patients are in need of neurocare, quick and timely decisions are required for the best possible outcome. Even when patients overcome the numerous obstacles in getting to healthcare facilities, there are still no guarantees for patients to immediately receive care. Over 600 patients compete for a single bed in the hospital, as the map shows. Despite this reality, the majority of healthcare facilities in Uganda continue to have insufficient bed capacity to accommodate all patients. All of the issues and previously mentioned and many more explain why novel solutions are needed to address the current deficit in neurocare within Uganda. Mobile health clinics have shown to be effective in addressing a variety of health issues for underserved populations all over the world. In this slide, we see how mobile health clinics are adaptable, where staff and services can be tailored to a patient's geographic location, culture, language, gender, and all service preferences to improve patient-centered care. Mobile health clinics are also capable of providing both preventative and curative care. Preventative care, as already defined, involves all measures taken to keep a person or a population from becoming infected with the disease. Curative care, on the other hand, is the provision of treatments and therapies to patients in order to cure an illness or condition. In underserved populations, mobile health clinics have clearly provided both preventative and curative care. Global health research has shown mobile health clinics to be adaptable, innovative, and cost-effective. Most importantly, they expand healthcare coverage to all communities. A quick Google search shows that the United States alone has over 2,000 mobile health clinics that serve over 7 million people who would otherwise go without healthcare. Mobile health clinics have been used for a variety of purposes. In Uganda, they have been used for outreach, education programs, preventative care, and many more other services. Mobile health clinics have shown to be safe and adaptable to patient needs in all of these areas. Following the description of mobile health clinics, neurocare has benefited from mobile health clinics in many communities. The idea behind mobile neurocare is to bring preventative and curative measures closer to the people who need them. From portable CT machines to the mobile neurosurgery kit used by Owl and colleagues, mobile neurocare can be presented in many forms. By designing and implementing mobile neuroclinics that can reach patients in rural and remote communities, patients who would otherwise have no access to neurocare would get neurocare delivered close to them. In Australia, for example, mobile neurosurgery was adapted. As a result, the time it took a critical care patient to go from triage to tertiary care was reduced by almost half. Owl and colleagues attest that time decreased from 6 hours and 16 minutes to 3 hours and 55 minutes. The decrease in time to definitive care shown by implementing mobile neuroclinics allowed for better outcomes for the patients who previously did not have timely access to neurocare. There are numerous examples of mobile neurocare that have yielded extraordinary results in other countries as well. Uganda is not a country like Australia or any other country. As a result, it is critical that we gather as many ideas and viewpoints as possible as we look for innovative solutions to better serve Uganda. and all its communities. The key players in this study include, from left to right, Duke Global Neurosurgery and Neurology, Duke Global Health Institute, and Makerere University. Thank you for taking the time to attend this education session. I would like to invite you to an interview so you can share your thoughts and ideas about mobile neural clinics. Lastly, here are all the resources we used in creating this content. Special thanks go to Chidibere Ibe, a student from Kyiv Medical University in Ukraine, for the illustrations in slide 3.